Hi everyone, my name is Cecilia, and today I'll be presenting a case study on Amwell, a leading telehealth company. From the perspective of system engineering in connected healthcare, I look at how system thinking supports the integration of complex digital health services. Here's the structure of today's presentation. I'll explain with a brief introduction to the topic of connected healthcare and why it matters. Then I'll provide the background, including the historical context and core technologies used in telehealth. Next, I go into the concept development stage, where I'll explain the need analysis, major technical challenges, and Amwell's service model. That leads into the engineering development. Then I walk through system design, testing, and integration measures used by Amwell. After the system's developed, I'll explain the post-development activities like the manufacturing and operational support. Then I highlight the main system engineering challenges that Amwell encountered and how they were addressed. Finally, I'll summarize the key lessons learned, followed by the references that support the case study. This roadmap will guide us through the Amwell's journey using a system engineering lens. Let's begin with a broader context: healthcare digitalization. In recent years, we've seen a rapid shift towards integration technologies like telemedicine, the Internet of Things, and electronic health records, or EHRs. These components together form the backbone of what we now call connected healthcare. According to Dawes and Paul, the integration is critical to build responsible, accessible, and data-driven care systems. Now, where does Amwell come into play? Amwell is one of the industry leaders in digital healthcare. It provides HIPAA-compliant, on-demand video consultations, which means it ensures patient data privacy while enabling immediate access to licensed healthcare providers. Their platform has been well received, achieving an 80% patient satisfaction rate as reported in 2020. The importance of such platforms became especially evident during the COVID-19 pandemic. The healthcare system was overwhelmed and in-person visits are limited. As a result, telehealth usage surged by 154%, according to Holder and Kerr. Amwell scaled its services quickly and efficiently to meet this spike in demand, where we will explore more deep depth later in this presentation. This introduction sets the stage of understanding why system engineering is essential in making connected healthcare platforms like Amwell not only possible but reliable and scalable. To understand the rise of connected healthcare and systems like Amwell, it's helpful to look at the historical evolution of telemedicine. It all began in the 1920s when doctors used audio to communicate with ships at sea, offering remote medical consultations. While primitive by today's standards, this was the first major step towards distance-based healthcare. In the 1950s, we saw the birth of telepsychiatry. One of the earliest documented examples was in Nebraska, where television was used to connect pediatric patients in rural hospitals with doctors in urban centers. This was an important milestone in addressing geographic access to care. By the 1960s, NASA played a crucial role in advancing remote health monitoring. Their work with astronauts led the development of telemonitoring and technologies, which later found applications in civilian healthcare, especially in remote patient care. In In the 2000s, the U.S. Veterans Affairs System scaled telehealth nationwide. Through extensive implementation, it reported over $65 billion in savings, a powerful demonstration of the cost-effectiveness of telemedicine when embedded within a large, structured system. Most recently, in the 2020s, the COVID-19 pandemic accelerated change. Medicare dramatically expanded its telehealth services, opening access to millions of people, including seniors and patients in rural areas. This marked the largest system push for viral care in U.S. history. Each of these phases laid the foundation for modern platforms like Amwell, combining decades of innovation in communication, medicine, and system design. It's not just about the technology, it's about adapting complex systems to meet evolving in human needs. Now let's take a closer look at the core technical components that enable connected healthcare systems like Amwell. The first component is telecommunications. Reliable real-time communication is the backbone of any telehealth platform. To ensure smooth video consultations, the system must support a minimum bandwidth of 2 Mbps. Technologies like wide RTC are used to establish real-time peer-to-peer connections that allow for low latency, high-quality audio and video. Without this, telemedicine would feel unusable, so this is truly foundational. And the second major piece is electronic health record integration, or EHR integration, to make patients' care seamless across systems. Amwell adheres to the HL7 FAIR standards. These standards enable to cross-platform interpersonality, which means that a provider using Amwell can access or exchange patient information with other healthcare systems, whether it's a hospital, a specialist, or a pharmacy. This is essential for avoiding duplicate tests, ensuring continuity of care, and improving patient safety. Finally, we have remote monitoring devices. These are FDA-approved tools that gather clinical trial data outside the traditional care setting. One example is AliveCourse Mobile, which patients can use at home to capture and transmit data. This allows clinicians to monitor conditions like hypertension in real time, reducing the need for in-person visits while still maintaining high standards of care. These three components, communication, integration, and monitoring, from the technological ecosystem that supports connected healthcare. In the case of Amwell, they are tightly integrated to deliver a smooth, reasonable, and data-rich telehealth experience. So let's now take a look at some of the key technologies that are shaping connected healthcare today. This slide highlights three main areas: mobile apps, wearable technology, and electronic health record systems, each contribution in a unique way. First, we have mobile apps. The Amwell mobile app is a great example. It doesn't just provide video consultations, it also includes an AI-driven symptom checker, which helps patients assess their conditions before speaking to a provider. This improves a street, saves time, and gives users a more personalized experience. Next is wearable technology, like the Apple Watch with ECG functionality. It's clear for heart rhythm tracking, meaning it's not just a lifestyle gadget, it means clinical standards. Devices like this allow patients to continuously monitor their health and share data directly with their doctors, enabling early intervention and better disease management. Finally, we have EHR systems like Epic's MyChart. This platform gives patients direct access to their medical records, lab results, appointment history, and even provider communication. It puts patients at the center of their healthcare journey, empowering them with information and engagement tools. Together, these technologies support a connected healthcare model that is patient-centered, data-informed, and system-integrated. Amwell doesn't operate in isolation. It relies on this broader digital ecosystem to deliver a full continuum of care. Before building any complex system, systems engineering begins with understanding the needs. In healthcare, these needs are both urgent and structural. First, there's a shortage of mental health professionals. According to the American Medical Association, 58% of U.S. countries lack even a single practicing psychiatrist. This makes access to mental health service especially difficult in rural or undeserved areas. Telehealth platforms like Amwell can help build that gap. Second, there's strong economic case. Telemedicine reduces healthcare costs by an average of $100 per visit, as reported by the Journal of Medical Systems. That's significant, especially when scaled across thousands of patients. Third, in chronic disease management, telehealth reduces the number of emergency room visits by 30%. It not just saves money, but also improves outcomes and reduces the strain on hospitals. For patients with diabetes, heart disease, or other diseases, regular virtual check-ins can prevent complications. These data points form the foundation of Amwell's system design. Addressing these needs through technology isn't optional, it's essential. Once needs are identified, the next step is concept development. It's exploring the barriers that could prevent success. One of the biggest challenges is interoperability. According to HIMSS, only 38% of hospitals in the U.S. share health data outside their organization. This severely limits the continuum of care. Without smooth data exchange, even the best telehealth platforms can feel isolated and inefficient. Another major concern is data security. In 2022, the HIPAA journal reported that 89% of healthcare organizations had experienced data breaches. That's almost everyone. Healthcare data is among the most sensitive, and any breach can lead to consequences, both legally and in terms of patient trust. So during this phase, Amwell has to ask, how do we create a system that integrates across device platforms and protects patients' information at every step? These challenges shape the decisions in system architecture and engineering. In response to these needs and challenges, Amwell developed a well-defined software model built on a modern, secure technology stack. On the front end, it used a React native mobile application, offering patients and provides a consistent experience across devices. This allows for rapid updates and cross-platform functionality. The backend runs on AWS cloud infrastructure, which is HIPAA compliant. This ensures scalability and legal data protection. The API layer follows HL7 FHIR standards, enabling seamless integration with external EHRs like Epic and Cerner. This device choice directly addresses the interoperability issue mentioned earlier. A particularly impressive metric, Amwell's onboarding time is twice as fast as competitors like Teladoc. That means providers can start delivering care sooner, and patients can get help faster. This is a result of thoughtful system design, not just marketing. Together, these components reflect a deliberate engineering strategy that emphasizes speed, security, and connectivity. Once the service model was defined, the engineering team moved to prototyping and performance optimization. They set ambiguous goals from the start. First, video response latency was kept under 2 seconds, a critical target for maintaining a neutral patient-provider interaction. Anything longer can degrade the conversation and user experience. Second, they aim for 99% system uptime. Its high availability is vital in healthcare. There, where services interruptions can mean missed diagnosis or delayed treatments. Third, they developed an NLP-powered street engine with 92% diagnosed accuracy, which helps determine the urgency and type of care needed. This supports efficient routing and lowers the burden on life staff. Prototyping at this stage wasn't just about building something functional. It was about proving the system could meet real-time performances, safety, and usability expectations. These targets aligns with the initial needs analyzed and helps guide the next phases of development. Once the prototype met performance goals, the system moved into design hardening and testing. This is where systems engineering ensures resilience, scalability, and security. Amwell used JMeter for load testing, validating that platform could support 10,000 concurrent users without service degradation. This is especially important during the peak times, such as flu season or emergencies. For penetration testing, they empowered PromSuite, a leading tool to simulate cyber attacks. The platform passes with zero clinical vulnerabilities, a vital milestone of HIPAA compliance and patient trust. This comprehensive testing process, converting performance, reliability, and secure, demonstrate the rigor of engineering discipline applied to a high-stakes healthcare platform. System integration was conducted using agile methodology, allowing for rapid integration and real-time feedback. In Sprint 1, the team focused on integrating electronic health records, or EHRs, over 8 weeks. They ensured seamless communication between Amwell system and external EHR platforms, essential for continuity of care. Sprint 2 last 4 weeks, implemented secure payment gateway integration, ensuring transactions met compliance standards while remaining user-friendly. After the integration, beta testing was launched with 1,200 users, and 93% rated the platform positively. Users highlight case of navigating, enable video connections, and a generally trustworthy experience. This feedback loop, build, test, adjust, allowed Amwell to fine-tune its system in real-world conditions, a core principle for system engineering. After software readiness, Amwell moved to hardware deployment, especially the Amwell Station device, a telehealth terminal used in clinics and hospitals. This device earned FDA Class II certification, verifying that it meets medical device safety and performance standards. It was also rated IP54, meaning that it's resistant to dust and water splanish, crucial for user in device clinical environments. The manufacturing process included 100% functional testing of each unit, with random branch qualifying sampling to catch defects. This step ensures not just regularly complaints but long-term reliability in patient care settings. A system's lifestyle doesn't end at launch. Post-development support is critical. Amwell offers 24 hours, 7 days multilingual customer service, supporting both patients and providers. This enhances accessibility and reduces frustration, especially in high-stress health situations. For urgent technical issues, Amwell guarantees a 15-minute response time, a virtual feature in live clinical scenarios. And finally, clinic onboarding is highly efficient. Doctors can be trained and certificated to use this platform in under 8 hours. This minimizes friction and helps scale provider participation quickly without compromising standards. These operational decisions reflect the importance of whole system thinking, even after the product is live. Here's an online therapy.
Hey guys, I recently signed up on Amwell Telehealth to try out their online healthcare provider service, and I pretty much just want to talk about my whole experience. In this video, I'll be going over enrolling in Amwell, as well as setting up your first appointment, and ultimately just finding out the best service in the Amwell experience for you. Amwell is an online patient service that helps make online doctor visits easier. They offer video sessions with therapists, psychiatrists, urgent care doctors, as well as specialists depending on what you're looking for. If you are 18 years or older, you can sign up for their digital doctor's appointment as well as counseling with Amwell. And there's no need to actually, schedule an appointment. All you need to do is sign up and then wait in the digital waiting room. This makes it super convenient for people who don't have a primary care provider, as well as people who can't make it to in-person visits, as well as if you just have a crazy schedule and you need something that's just super more accessible and convenient for your lifestyle. When you first go to their website, you're met with an introduction to the services that they provide, and then there's a For Patients tab on the right sliding menu that you can pretty much click on. And what I do love is a lot of healthcare providers, immediately you go and they hit you with a survey where you have to answer all of these questions about yourself and all of this different jazz. But with Amwell, they actually, just give you a full page of the services that they provide, so you really know what they're offering you to help you. That being said, once you click the For Patients option, then get started, all you need to do is plug in your insurance provider, and if that's accepted with Amwell, then you pretty much just have to pay the same amount as an in-person doctor visit. From there, you fully sign up, creating your personal account, plugging in your information, your birthday, your location, and then you are met with a detailed survey that, just helps Amwell, get your background, your preferences, and exactly what you're looking for with the services that they provide. This survey took me about 15 minutes total, and honestly, what I love love about Amwell is just the ease and flexibility with their services. Once I finished the survey, I was matched with a couple different doctors and just options that I had. After the initial questionnaire, a staff member matches you based off of your location, your symptoms, your schedule. When there's more than one suitable option, you can really choose your doctor based off of their ratings, their experience, just your personal preference, and whatever else you feel, goes into choosing which doctor is best for you. I just love the flexibility in this pairing process because choosing a doctor can be a very, very personal process. But once you do choose a doctor, you can immediately start your virtual session, and you can do this on video or on chat. It is available on desktop or via mobile app. I wouldn't recommend Amwell for anyone with severe medical conditions, but I do think it's a good option if you have common conditions or you're just looking for a routine health check. The cost of Amwell depends on the type of service a person chooses. For example, a person can expect to pay up to $129 for a therapy session, $279 for an initial psychiatry session, and $109 for follow-up sessions. The most expensive Amwell service is the second opinion service, which costs around $1,850. This package includes an on-demand or scheduled intake visit with a nurse care manager who will collect your medical records and imaging. After your initial intake, you're given a review and assessment on your condition by a Cleveland Clinic specialist. Lastly, you're given a one-on-one educational consultation with your specialist to, go over the second opinion and any other questions that you may have. Amwell accepts insurance from a wide range of providers, including Cigna, United, and Infinity. If you don't have insurance, your visit will be charged to your credit card. The visit cost will vary depending on the service/specialty, but urgent care visits start at $79, while therapy visits price at $99 at master's level or $110 at doctoral level. Overall, I really like the Amwell service. I found the whole process super smooth and easy. I don't personally think, though, that you need it in your day-to-day life. I feel like it's if you have specific symptoms that you want to get checked out, or, you're feeling kind of under the weather. But I do believe Amwell is a great baseline service, if you need quick urgent care visits, or, you want virtual care and you don't want to deal with, the germs and the stress of, trying to set up a doctor's appointment or even being in the doctor's office, because that is kind of stressful. But overall, I really, really liked it. I would not recommend this service for anyone who's looking for an official diagnosis, but if you are interested in other therapy providers that I recommend, all you have to do is click the links in the description below. Amwell may not be the best option for you if you're under 18 years of age, you don't have an internet-enabled device and reliable internet connection, you're looking for medication, prescription, and management services, you need official diagnosis, you've been diagnosed with a severe mental health illness, you have a condition that requires face-to-face appointments, more intense mental health treatment, or on-site medical assistance, you are required to undergo court-ordered therapy, you demonstrate self-harming behavior or have thoughts of hurting yourself or others, you experience suicidal ideation or exhibit suicidal behavior, you're in a crisis or a life-threatening situation.
Despite its success, Amwell faced significant systems engineering challenges. First is data sales. To ensure cross-system communication, Amwell invested $11 million to build HL7 adapters, enabling data exchange between otherwise incompatible health systems. Second, regulatory compliance. To meet HIPAA and HITECH regulations, Amwell employed 3 full-time compliance officers. Their role is to embed legal and essential standards into every layer of the system, from architecture to daily operations. These challenges require carefully cross-disciplinary coordination. Engineers, legal experts, and healthcare professionals had to work together seamlessly, something only possible with a strong systems approach. To wrap up, There are key takeaways from this case study. First, interoperability could be primarized early. It determines how well the system scales and collaborates with existing infrastructure. Second, zero trust security, where every user and device must be constantly verified, significantly reduces break risk in sensitive healthcare environments. Third, user-centered designs isn't just about aesthetics. By making the system intuitive and responsible to user needs, Amwell reduces support requests by 40%, freeing up resources and increasing satisfaction. Ultimately, Amwell shows how systems engineering can guide healthcare innovation from concept to scale. It's about designing with intention, planning for complexity, and staying aligned with real-world needs. So, thank you for your listening. Thank you so much for your attention, and that's all about my presentation.